and thanks for joining us on our YouTube channel. I'm Rebecca Pepin with Fetching Apparel, and welcome to another edition of Pet Tips Tuesday. Today's topic is flea and tick prevention with Dr. Andy Cherry with Cherry Point Animal Hospital in Kingsport, Tennessee. And I know a lot of people, when they start taking the flea and tick meds, they say, oh hey, the cooler weather is on its way, I can stop.
Right, no, exactly. We really want to continue it year round. The prevention of heartworms or fleas and ticks is very important year round as we get warmer months in the winter. Every year now it seems to get warmer and warmer. And especially in the fall, fleas tend to move around more. They're looking for warm spots and places to be. So, actually we tend to see a resurgence of the fleas in the fall.
And talk a little bit about what could happen to you if those ticks come in the house.
Well, ticks can carry what we call the tick-borne diseases, which are things like Rocky Mountain spotted fever, Ehrlichia, Lyme's disease, and most people are familiar with those diseases now. So we would like to prevent those, prevent having loose ticks in your house, just to also prevent us from getting those. Not only can your dog get them, we can get them too.
And flea allergies.
Flea allergy, dermatitis in dogs is real important. Some animals can come in here with 1,000 fleas on them and never scratch, and others come in here with 1 flea and they don't have any hair. Those animals are truly allergic. And of course they scratch, they itch, it's like us having a bad allergy, and that can progress to skin infections, hair loss, things like that.
Is it important to apply these medicines exactly to the letter?
Right, most of the boxes and the medications have the instructions on them. There's topicals, and some say to, like on this pet, to apply it in 3 different places. It can be on the back of the neck, middle of the back, and at the tail rump there. A lot of them used to be only at the neck, but now they have different application instructions. There's also oral medications now which work great, and what I actually use on mine, because that way we don't have the topical stuff around children, if they're hugging on the pets and things like that. And even though a lot of the topicals always said, bathing them has no effect, it does seem to lessen the effectiveness for those ones that are supposed to last 30 days. So a lot of the oral medications now prevent both fleas and ticks.
And they last longer.
On a thick-coated dog like this, they're, the medication's in the skin when the flea or the tick is there, and then that way it's not affected by, especially a long-haired, coated dog. So I like those. There's different ones based on their age. A lot of our flea and tick medications we use based on age, and so picking the correct one for you a lot of times, talk to your vet about it. Sometimes puppies can't have the same ones as adult dogs can have. So we do try to base that both on your pet and your pet's health. For some reasons, there's ones we don't use topically. If you have a dog that has, skin dermatitis, has allergies, things like that, we may not want to use a topical one because we may not want to create a local reaction. And you might use the orals instead.
And the orals last a little bit longer?
There's one oral that lasts for 3 months for both fleas and ticks, and there's one that's monthly. And I use the one that lasts for 3 months and have found it to be very effective. And my dog's in the lake all the time, in the pool. My son's dog's in the pool 24/7, and I don't have to worry about him washing it off.
There are a lot of places where you can buy pet meds online, but you say, go to your vet, your prices are competitive.
Right, and I think, your veterinarian is your first source to what's best for your pet. And in most cases, our drug reps back us up. They will, if this product is not working for you and, you apply this product and 2 weeks later, for whatever reason it doesn't work, we'll generally replace those products based on which ones they are. And, we have that line of communication with our drug reps that want your dog. They want your dog to be flea and tick and flea free. So they're going to do their best to make sure that works. And it's hard to have that online relationship with somebody. So we want the effectiveness to be what we want you to get what you pay for and what's best for the pet and your family.
All right, thank you very much.
Okay.
Thanks for joining us for this edition of Pet Tips Tuesday. As always, we will recommend that you do your research and your homework and talk to your vet about what is best for your pet. And of course, you can always call Dr. Cherry's personal cell phone. That number is 423. Okay, just kidding. Have a great day, everybody.